and we'll be sharing some of the eye openers and hard truths that we've been coming to terms with in Canada around what it looks like to do prevention at the front line. So to give you a bit of a sense of where we're going, the National Network for Euthanists have been partnering on this webinar series, building up to a workshop that we're going to do at the summit next week. So if you aren't registered for the summit yet, we encourage you to do so and to please join us for our workshop that'll be happening on Thursday afternoon at 4:35. So just to give you a sense of who we are, I don't know, MJ, I might be taking over at your point. You
That's
can...
okay, I can jump in, no problem. Yeah, I just wanted to before we talk about who we are as an organization, just wanted to let you know that Amanda Bucknia, Orpa Kundangan, myself, Mary Jane McKitterick, and Heidi Walter are all from Away Home Canada. I'm really super happy to be here and share our learnings and knowledge with you folks. So looking forward to it. Go next. Yeah, so we are coming here together online from across Turtle Island, and right now in Canada, as a result of the Truth and Reconciliation Commission, our Missing and Murdered Indigenous Women and Girls Commission, and the Land Back Movement, organizations and individuals in Canada are learning how to provide land acknowledgements as a way of engaging with our history and colonialism and white supremacy, but also our commitment to truth, justice, and reconciliation moving forward. So non-Indigenous people are still learning how to do this respectfully, and this continues to evolve as we learn about and accept our responsibilities. Today, though, since this meeting is being held online, a singular land acknowledgement doesn't really capture the richness of our distribution across many locations on Turtle Island and around the world. There are a few places on Earth that someone before us is not called home, and as Away Home is hosted in Toronto, although some of us are not there, we would like to share that land acknowledgement that is used there, and invite all of you who are joining us today to consider your own position with regard to the land where we find ourselves. So Away Home Canada acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaranto has been caretaken by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. Now it's home to many First Nations, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississauga Credit of First Nation, and this territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Thank you. Great. So right now we're going to talk, I'll just go over a bit about, oh yes, so we were going to say this is session 2 of 3 sessions that we're collaborating with the National Network for Youth. The first session was on the shift to prevention, and we hope you have that, but there is a link to that if you want to review that one. Today we're unpacking frontline prevention, eye-openers and hard truths that we're coming to terms with in Canada. And as Amanda has mentioned earlier, we will finish off our series at the summit workshop on cross-systems youth homelessness prevention, examples from Canada and the US. Look forward to seeing you there. So, Away Home Canada, what are we? Who are we? We're a national coalition in Canada that is focused on reimagining solutions to youth homelessness. Much of our work happens in Canada, but we have partnerships globally, and several local chapters of Away Home are in the US, Europe, and Australia. We're all united in our mission to prevent and end youth homelessness, but you can visit our website at awayhome.ca to learn more about our work. We also believe, sorry, next slide too. Oh, you've got it. No, you're good. I'm behind. We believe that change occurs at the intersection of policy, planning, and practice. This ensures that solutions to youth homelessness reflect the realities of communities, but they're also connected to those broader systems change that are required to have lasting impact. And the next one, yes. So today's presentation, we're going to be talking for about an hour on frontline prevention and the lessons learned, but we will make it a bit more interactive. We've got some polls and some chats and some jam boards and things so to get your impressions about some of this work and work together. And then we hope to have some time afterwards for questions, comments, and conversation. But the first portion, there's quite a bit of content to cover as well. And then I think we'll have a few minutes at the end to just kind of go over what to expect at the summit next week. And the next one is you, Amanda, if you want to take our shift to prevention.
Yeah, so this is a bit of a recap from the last webinar. So if you attended, this will hopefully be familiar to you, but if not, just to give you a sense of what the kind of work is that we've been trying to mobilize here in Canada, and also it's a bit of, like, as Mary Jane said, an international movement, is that we currently have a response to youth homelessness that's very much like this first set of images, where we have a heavy focus on crisis intervention, a little bit around prevention, and a little bit around sustained exits. But where we really think we need to go is to having a bigger focus on prevention and sustainable exits. And we'll always need some kind of crisis intervention, but that in order to really support young people before they end up in crisis, and to also get the sector out of crisis mode, there needs to be a shift in approach. And so all of our work is really exploring what does it look like to actually shift to looking at a world where we really focus on prevention. And so what we're going to do now, I'm going to just stop sharing here and switch over to a Jamboard, and I'll throw the link into the chat for everybody so that you can join us. Because the question that we have for all of you is, what is your impression of thinking about shifting to prevention? What would it look like, or what might be some of the concerns or thoughts or questions you might have about prevention? Are you excited about thinking about the shift to prevention? Does it raise any fears or concerns for you? And what you can do if you go into the Jamboard, you click the link that I just dropped into the chat. There's a little sticky note tab here that you can add your thoughts, and we can kind of keep moving along as we'll use this a couple of times in the presentation, but you can type whatever you think about prevention, and then save it, and then move it around to wherever you want to put it on the board. So I'll give you a couple of seconds to jump in there if there's any thoughts or questions that you have about prevention. We may not explore them right away, and it might be something we dig into our chat and at the end. But we're curious to know how prevention sits with you folks in the United States at this point. So I'll give you a second to do that. And while you're doing that, I will go back into our presentation. Or if you would prefer, you can also just throw things in the chat. That works as well. I know that we don't have a critical mass of people today, so that's quite all right. And maybe you can ruminate on this question as we get into talking about frontline prevention. The other thing that we wanted to know, and you can use the same Jamboard space if you want to add your ideas and thoughts, is what you think prevention actually looks like, and who you think is responsible for this work. Heidi, did you have a question? No, you just, okay.
Just wanted to let you know that I was here.
Oh, good. It works. Raising your hand works. Right. Okay, well, I think we can just jump straight in then, Mary Jane, if you want to give us a rundown of where our thinking's at on prevention.
Sure. So, as as Amanda has said, we want to shift to prevention, and we want preventing young people, and so that means to us preventing young people from experiencing homelessness will reduce the likelihood that they will experience chronic homelessness. So part of that answer is that prevention, rather than impossible, and I'll just step back to our last webinar as well, we talked a little bit about how for many years folks said prevention wasn't possible, that it was something that we just had to live with, and that chronic homelessness was where we had to focus. But we really discovered that rather than impossible, it's the key to addressing homelessness in Canada and globally. It means a couple of things. It means starting with young people early in their life to offer support and services and opportunities to keep them connected to their communities, their schools, and whoever they identify as family. So interventions before they leave home and well before they get close to a shelter or street life. But also prevention also means that connection between homelessness and youth homelessness and adult homelessness. So if we focus on preventing a situation of homelessness occurring early in a young person's life, we're also more likely to reduce the number of chronic homeless people in Canada, because research has shown that there's a significant portion of the chronically homeless adult population that once experienced homelessness as young people. So we like to say that ending youth homelessness prevents chronic adult homeless, or at least helps to in part. So. And we also briefly introduced, I guess, our sort of keystone resource at Away Home and the COH, or the Canadian Observatory on Homelessness, is the Roadmap for the Prevention of Youth Homelessness. It's been a really key work for us, because we wanted to understand, if we all wanted to shift to prevention, what did that mean? What was prevention? What did it look like? What did it entail? And then what wasn't it? Because we had a lot of communities were engaging in it, but maybe doing things that weren't necessarily amazing work, important work, but not necessarily prevention. So in the roadmap for the prevention of youth homelessness, it's a fantastic resource. We encourage you all to come take a look on our website and really dive into that. But there are 6 categories. So we did a typology that included 6 categories of prevention, including structural prevention, systems prevention, early intervention, evictions prevention, housing stabilization, and a duty to assist, which you may have encountered last year when we were at your summit, before all of the world kind of went crazy. But so today we're going to use it to look at what we've learned just around frontline prevention. And that means we're just going to focus on the categories number 3 and 5, which are early intervention and housing stabilization. And we're really just going to touch on those briefly. Because they are the ones that influence frontline service provision the most. They include the programs and services that youth would access in their communities to prevent or sustain exits from homelessness. But I think critical for this conversation is really about those important revelations. So we've been testing these interventions out quite a bit with our demonstration sites with Making the Shift, and Orpa's going to talk about that next. But through our demonstration projects and some heavy research with youth and frontline practitioners, a lot of things have really emerged, and I think that's where we want to focus today. So those assumptions about what prevention is and the nature of youth homelessness prevention. And at the summit, we'll take a look at the systems and structural elements on the roadmap. So we won't be looking at those today, but they are to come. So thank you for your patience. And next, Orpa, I'm going to turn it over to you to talk about prevention a little bit more.
Thanks, Mary Jane. So along with the roadmap for the prevention of youth homelessness, we also wanted to show you a little bit of a diagram about the continuum of interventions that make up prevention or include prevention. I know from personal experience, before I started at Away Home, that I assumed youth homelessness prevention only occurred before a young person became homeless. But prevention actually includes a continuum of interventions and can really come into play at many different points in a young person's journey. So from early intervention, which you can see here within schools, and while young people are still living with their family and natural supports, doing that work with their FNS, to sustaining exits from homelessness, which is towards the end of the diagram here, which includes things like supporting them to exit shelter and to find housing. So we just wanted to give you a little bit of an overview of the different sorts of interventions and models that are included in the continuum of prevention. And we'll expand more on this piece about exiting systems at our session during the summit on March 25th. I'm also going to talk a little bit about the Making the Shift demonstration sites, as Mary Jane mentioned. So we have, through the Making the Shift demonstration lab, which is co-led by Away Home Canada and the Canadian Observatory on Homelessness, the purpose of this demonstration lab is to build an evidence base on some of the interventions and models of prevention that we went through in the last slide, or that you saw in the last slide. So through this demonstration lab, we're supporting 8 family and natural supports programs in Alberta and Ontario, 3 Housing First for Youth programs in Ontario, 1 Youth Reconnect program in Ontario, and 2 upstream project sites in British Columbia and Newfoundland. And I might have just thrown a whole bunch of words at you that you're not that familiar with. We're going to be getting into family natural supports and Housing First for Youth a little bit more and what that looks like in practice within this presentation. But we can also follow up with resources and links for you to read about what these different program models and interventions look like. And so with Oh, sorry, can you go back to just the one slide, Amanda? Thank you. And so with Youth Reconnect and Upstream, we're focusing a lot on early intervention, as we mentioned in the continuum. And with Housing First for Youth programs, we're supporting youth to sustain exits from homelessness. And with FNS, our FNS sites are actually hosted within a few different contexts. So some of them are operating out of shelter, where they're working with youth who have entered the shelter system, and they're working with them to reconnect with their family or to do family mediation or just to support them towards independence. But FNS can come into play all along that continuum too. Thanks, Amanda. I think I'm turning it back to you, Mary Jane.
Oh, yes, sorry. I was looking at emails and things. There we go. So here's a slide with a little bit of information on what we mean by early intervention. And I'm kind of assuming that a lot of this is going to be very familiar with you folks too. It's like, a lot of it's not really rocket science. It's, we need those systems of care, et cetera, that will all those pieces pulled together. But we'll just kind of step through where we're coming from in terms of how we're using this to shift to prevention for youth homelessness. So early intervention includes a number of program areas, and you can see that on the left-hand side of the slide, as well as aspects of a coordinated system of care, which you're all familiar with, of course. And you can see that on the right-hand side of the slide, within the box, sorry, the yellow box. It involves recognizing the need for program models and services in our communities to intervene upstream long before young people are leaving home, accessing shelters, housing programs, or becoming street involved. So intervening upstream is really about place-based interventions that try to keep people connected to their family, their community, their schools, and other supports. And some of these program models include the Family and Natural Supports, we call that FNS for short, Youth Reconnect, and sorry, we're going to go into FNS quite deeply in the next bit. Youth Reconnect, which is place-based and school-based, which is another really important element to all of this work. And then the Upstream project, or the Upstream Canada, which is school-based, and you actually have that intervention being piloted and demonstrated across the US as well, particularly Seattle, I believe, or Minnesota. So we also know that it's not always possible or safe to keep a young person in their home. So we talk a lot about keeping families together and keeping people at home, but that's not always possible. And so when that's not safe, we also include interventions where young people and their families may need to press that pause button. So that's also considered part of this work. When we're in that place, our role is to access supports that they already have in place, like a neighbor or an aunt or an uncle. This is less of a disruption. It keeps them in their school with their friends and their community. But the key is we wrap supports around those supports, so they're not just being sent off down the street. We have active supports, and we'll go into what that looks like. Some of those examples might be shelter diversion, but we're also talking about things like host homes, or like we say, individuals, members of the family, concerned adults who have connection that the young people choose to be with. So to explore some of what early interventions look like in practice, we're going to focus on our learnings from Family and Natural Supports work. Some of this has really challenged our assumptions and inform our overall thinking about the role of families and natural supports in preventing and ending youth homelessness and making those connections. So I will turn it back to Orpa. Thank you so much.
Thanks, Mary Jane. So as Mary Jane mentioned, shifting towards working in a family natural supports approach and just shifting towards prevention involved a lot of acknowledgement of assumptions that we had been carrying about what it was like to work with youth and their families. And so we're wondering, we wanted to, as Amanda said, keep this presentation a little bit interactive as well. So we thought that if you were comfortable putting in the chat some of the assumptions that you carry when it comes to working with families and natural supports. We want to preface this by saying that there's no judgment here. the things that you put in the chat might be assumptions that you've heard just in your experience and with the work that you do. So if anyone wants to add anything, the chat is open there. I'll just give you a minute to answer this question here. So what assumptions are we carrying when it comes to families and youth's natural supports? And feel free to keep typing if you have a thought. I'll just turn to a few examples that we've come up with in our work and that we've been challenged by. So sometimes, we can think that, oh, Mayra, I hope I'm pronouncing that right. Families can get busy and the support is not there. Definitely. Andrew writes that sometimes he hears that parents don't want to be involved. Definitely true. Other assumptions we've heard are that, if a young person has left home, then the family is the reason for that, and they won't want to reconnect with family because of that break in the relationship. That, youth choose to run away, or that they're lazy. We sometimes hear that from different people in our work, and that there's this refusal to follow house or parent rules. We've heard that, parents can have a history of abusing young people, and that if youth grow up in care, that there's something wrong with them or their family. So thank you for highlighting some of those assumptions, Andrew and Mayra. We carry, the reality is that we carry many of these assumptions, and they can impact or hinder our work, especially when it comes to working with families and natural supports, because we have, our own personal experiences, experiences of working with other systems that work with family and natural supports, our own biases, and we're human. But if we can take the time to recognize these assumptions and ask ourselves, what do we know to be true about these assumptions, then we can really challenge, how those assumptions are showing up in our work, and whether we're really listening to families and natural supports when they're sharing their own stories with us. So definitely something to keep in mind as we're moving through the next pieces of this presentation. We wanted to start with this because the shift towards a family and natural supports approach really was a change in how we were working from the status quo. So if you want to flip to the next slide, Amanda. We've seen that shifting this way involves challenging some of these assumptions that we carry about youth and their families. And Heidi is going to go into more detail about each of these points and what it looks like in practice. So you don't have to try and screenshot or memorize this right now, but we did want to say that shifting to this different approach towards this family and natural supports approach required us to work in a different way than we had been working before.
Thank you, Orpa. So as Orpa had said, we have spent quite a bit of time shifting our attitudes all the way from a leadership perspective in agencies and communities all the way down to the front line to help people understand why this type of work is important. And so just going through some of these status quo approaches and some of the ways that we have highlighted the importance of this work. We appreciate you being here and know that it's going to feel a little bit speedy at the pace that we're going to go through some of these, but always willing to answer questions and be there beyond this presentation. So our first instinct is to meet every need. Our first instinct story is to meet every need with a professional support. For those of us who have been working in the youth sector for quite some time, or any of the helping professions, we know that we have been trained almost to say, oh, this is a deficit area in your world. You might want to look at, connecting to this and this. And what we're really doing within the FNS approach is making sure that our first instinct is not to insert a professional or a system. Like a youth shelter, so on and so forth. When we insert professionals and resources first, we are automatically making the assumption that families do not have their own resources and supports. And it really undermines and enables the family to believe that they need these types of supports, and really takes them out of the driver's seat and out of wearing the expert hat. So we spend a lot of time in this space when we first get to know young people, when we first get to know families, and take the time to ask questions, be curious, and acknowledge that the family and the youth are the experts, and we're merely somebody that has been invited to walk along their journey with them. So really just sitting alongside of them. Professional supports are not sustainable, and that's something that we really had to focus on. We're not going to be this youth or these families forever people, and so making sure that they have family natural supports to lift them along for ongoing time is really quite important. What we also know is that attending to basic and physical needs like food, shelter, and clothing are important, and so are relationships. Like many of us has learned in post-secondary education about Maslow's hierarchy, basic needs are essential for all of us to move forward or upwards in Maslow's hierarchy, in goal setting, growth in all areas, and in development. But what we know is that when young people are hungry, they're not able to focus on their other pieces of work. They struggle to maybe create goals. And so much like food, mittens, washing, showering, relationships are also as important as all of those basic needs. Connection and belonging to community and people are just as important. There is so much research coming out, specifically out of the Canadian Observatory on homelessness, even last week with a blog report laying an understanding for all of us that loneliness is as lethal as to somebody who smokes a pack of cigarettes a day. So when we start to think about smoking and relationships as important, it really starts to change the I guess the importance that we're laying on relationships and human connection. This one, Amanda is great with photos that will make you laugh. So obviously we like to protect kids and wrap them up in bubbles, but may not always be totally appropriate, and or we can't always do that. I think as humans, especially those that are in the helping field and have dedicated their careers to wanting to help others, I think it's our instinct to protect from harm. And that's no different for us supporting those families and youth that we work with every day. That being said, what we do know from young people and research is that over 70% of young people, and this is of course Canadian data, but over 70% of the young people that have been apprehended or taken away from their biological families and brought into a children's services system, 70% of those young people actually return back home at some point. When we started to understand this and we started to unpack this, we realized if this is true, and if young people are going to return back to their homes, regardless of unhealthy they were, regardless of why they were apprehended, why would we not spend time supporting them into creating healthier boundaries, increasing their communication skills, and allowing them space to be able to define what types of relationships they want to have with their family, because they're going to anyway. So why don't we just help them along and spend time doing that? Sorry, I was just looking at the chat. I apologize there for a second. So we solely focus on the youth. For lots of us that have been working in the youth sector, our primary focus has always been the young person, making sure that their voice is heard, making sure that their needs are being met. But with the FNS approach, really, we still believe that the youth is important, but we also recognize that the family and the youth designated natural supports are also as important as the young person themselves. We want the family to be able to have goals. We want the family to be able to have supports and the possible resources, because those two are going to impact the way that that young person moves along their trajectory and their healing journey. I believe I'm going to pass it over to Orpa again.
Awesome. Sorry, had to unmute myself. So Heidi went through some of what the shift to taking a family natural supports approach looks like. And we also have 5 core principles that make up the family natural supports model. And we can share the recently released framework for family natural supports as well, which includes these core principles and more information about what that can look like in practice too. But you'll see that everything Heidi mentioned in terms of how FNS's practice speaks to one or more of these principles. And an important thing that we want you to know is that we're constantly having conversations around whether or not family natural supports needs to be a program, or whether it's about a way of working, an approach, a philosophy, and really it can be all of those things. You can have a program designed specifically to support young people and their family natural supports as part of the programs and supports that you offer at your organization, but you can also take an FNS approach or use that philosophy in any program across your organization or in your own work as the underpinnings of how your work is delivered. I think with that being said, Andrew's going to share some examples from the States about different ways that programs are incorporating families into their work as well.
It's dropped off again, unless
oh, okay. Sorry, I missed that, folks. We can go into Housing First for Youth, and maybe perhaps at the end, he can share some examples from the States, if that would be helpful for folks. Cool.
Do that. So that was an overview of some of the things we're learning on the front line around early intervention. And now the other component of this is housing stabilization. So on the other end of that kind of continuum that Orpa had talked about at the beginning, we have not only do we want to prevent young people from ever experiencing homelessness, but in the case where a crisis happens, a young person experiences homelessness, we want to make sure that this doesn't become a repeated cycle throughout their life. And so that's where housing stabilization really comes in, is thinking about beyond just housing, what is it that a young person needs in order to set them up to have housing stabilization for their whole life. And so when we look at what's involved in housing stabilization, programs will often focus on a number of different areas of a young person's life, including their health and well-being, their access to income and education, and making sure that once they're out of their housing crisis, how are they now being able to get access to the training and support they need to become employed or go into education. Complementary supports, which could look like things like legal and justice support and advocacy, or some of the professional supports that they may need at that point. And then finally, social inclusion, making sure that a young person really feels like they are a part of a community and has a network that they belong to. And thinking about, in terms of natural support, some of those may be more informal supports that are not necessarily professionalized, as Heidi had spoken to. And so to explore a bit more of what housing stabilization looks like, we're going to look at examples from the Housing First for Youth work that's been done through the Making the Shift demonstration labs. And as Orpa had said, that we have 3 Housing First for Youth demonstration sites. One is Indigenous led for Indigenous youth, and another is focused specifically on youth exiting care. But we're looking at different ways that this program can adapt to meet different young people's needs. And other models that you might be interested in learning more about include the HOP-C, which is the, oh my goodness, I forget the acronym now, but we'll include links to it. It's basically kind of like an interdisciplinary model where it has an outreach component that has professionalized supports as well as peer support, all working together to connect with young a young person and wrap supports around them and get them into housing and accessing all of these great things that we're talking about here. And then there's the foyer model as well. And if you're interested in learning a bit more about the Housing First for Youth work that we're going to be talking about, there are a couple of resources out right now, including A Safe and Decent Place to Live, and then this is Housing First for Youth, a program model guide, which is actually getting a bit of an update and a refresh. I don't know if Heidi, you might speak to that later, but yeah, there's always more coming out. So we encourage you to keep an eye out on the Homeless Hub site. And so now I'll pass it back to Orpa to jump into our learnings around housing.
Thanks, Amanda. So just like we did before we got into talking about family natural supports, we want to ask you again once again to put in the chat assumptions that we're carrying when it comes to housing young people. And once again, there's no judgment here. These don't have to be your own assumptions. They can be assumptions you've heard in your work, maybe working with landlords or other people who are supporting you to house young people. But I'll give you a minute to just write down an assumption that you've heard around housing young people. And feel free as we're going through this to pop some of those assumptions into the chat at any point. From our perspective, it's always incredible to hear about what's going on in your context where you're working and some of the challenges that you're going through and maybe some of these assumptions that you're facing right now. Mira, thank you again for answering. Fear of crime, people definitely, criminalize youth. You know, that it can be hard for youth to maintain housing because of, you know, they're assumed as criminals or that they have criminal pasts, and that can change the way that we think about how they can maintain housing. For sure, that's a big one. Heidi, that young people don't have enough skills to be housed on their own, definitely. And so maybe we'll move into the next slide here, but these are some assumptions that we've seen or heard around housing young people. Some of these you've mentioned. You know, we've heard that you can't give youth housing without them having worked for it. We need to create consequences for youth, you know, when they're on the verge of eviction or getting evicted, that housing and supports should be contingent on a young person's performance or behavior. So how well they're doing with other aspects of programming to show that, you know, they're trying to maintain their housing. Mary Jane, that young people won't have jobs, so how can they pay their rent? There are so many assumptions like this. And again, I think it's we think it's a useful exercise to just recognize that we make these assumptions, we hear these assumptions. You know, when a young person doesn't show up for a meeting or when they're on the verge of getting evicted, we might have thoughts and feelings about why these things are happening. But we do our best work when we acknowledge that we carry these assumptions in our daily lives and in our work. And just like we did with family and natural supports, we can hold ourselves accountable to challenging our assumptions about young people and their experience finding housing and what it's like to house them. And through challenging these assumptions, we can show up better in our roles and show up better for youth and families who are all involved in supporting the people that you're working with. So when Housing First, the program model first took off in Canada, we were challenged by some of these assumptions. And we saw that Housing First wasn't demonstrating the same level of positive outcomes for young people as it was for adults. So we asked ourselves, what would it take for Housing First to work for young people, to improve their housing stability and to improve their long-term outcomes? How can we support youth differently than adults, and why do we need to do that? And so if you go into the next slide here, the one before, Amanda. So here you can see that we adapted Housing First principles to shift our way of working towards Housing First for Youth. So these core principles inform the Housing First for Youth program model, but they can also inform your agency approach for working with youth and families. And Heidi's going to spend a bit of time unpacking each of these principles as they relate to practice and what they can look like in practice and how they've showed up with the folks on our making the shift demonstration sites and in other places, but she'll also be sharing some personal and professional experience in this space. And I'd love to turn it to you, Heidi, just to talk about your experience in making that shift from Housing First to Housing First for Youth, because I know it took a lot of work across the organization that you were at to make that change, right?
It did actually, and lots of vulnerability, I think, and really having to take a hard look, and what I like to coin now as leaving our egos at the door and realizing that what we were doing previously was maybe not um, serving young people the best and was not producing the best outcomes. And so that took a moment for all of us to realize that this wasn't just a pivot. This was going to be something that we needed to change forevermore moving forward. As Orpa had shared and Amanda had shared, I really, if you haven't seen the This is Housing First for Youth model guide, I really strongly suggest that you take a look at it. It's on the Canadian Observatory on Homelessness. Maybe Amanda is able to link it here in the chat box, but it's absolutely brilliantly well done. And it speaks to everybody from frontline service providers all the way up to leaderships of how we have a role and how that program model really can look from any type of perspective. Of course, I've been very fortunate to be involved in the Housing First for Youth model since 2009. So I'm about to try to share all of the stories and lessons with you that I felt were the ones to highlight over the years of understanding how to do Housing First for Youth. If you are interested in more information, please don't hesitate to connect with any one of us. The Canadian Observatory on Homelessness also has self-paced e-modules that you can do that try to prepare individuals for a model shift from Housing First to Housing First for Youth. And then also Away Home has the Housing First for Youth training, of course. So to start, we had mentioned that in our assumptions, when Orpa went over our assumptions, is that too often when a young person loses their housing, they're also taken out of the supports that they were receiving as well. Instead, what we think about and how we shifted our thinking from a Housing First for Youth perspective is that when a young person loses their housing, whether it's because of eviction, whether it's because of poor guest management, because it's not paying rent, that doesn't need to mean that they are also have their supports taken away from them. Their supports need to stay with that young person, and it should not be connected to their housing. With preconditions and consequences, just wanted to really unpack those two words for a second. Consequences and requirements of young people that we have is going through homelessness, that have experienced homelessness, that have experienced trauma, adverse childhood experiences are so high that we really shouldn't even be thinking about what a consequence fits and what a consequence would look like because of their behaviors. This world is truly filled with natural logical consequences. Again, it was a shift in working from a place of going to natural and logical consequences and allowing those to take place when it was appropriate. But young people learn much more quicker and have the ability to understand and change their behaviors when they learn from a place of natural and logical consequences. And again, housing and supports are separated. So this means that if a young person, again, loses their housing even 11 times, because that is the most that I've ever housed one young person, we still show up the next morning. We still ask them what happened, what we're going to do differently today, and what support looks like for them moving forward. We don't stop supporting them just because they've lost their housing. For our next slide, we're just going to talk a little bit about youth choice, voice, and self-determination. We go in great detail in our Housing First for Youth training over this core principle because choice absolutely has been misconstrued in lots of different in lots of different contexts. And so how we like to talk about it is that choice is not infinite, but it's within reason. So no person in the world, like, okay, well, maybe the Kardashians or something, but no person in the world has infinite choice. And they have to have some type of, like, I guess, lines, if you will. There are always real world boundaries and barriers to choice. When we ask young people what kind of type of housing that they want to live in, this does not mean that we have the means or the ability to support a $2 million apartment, but giving them the information to process the choices that are available. So if there's only rooms for rent, if there's only shared accommodations, explaining to them why those are the options, explaining to them about finances, explaining to them and sharing all of that information with them is actually quite beneficial. Lots of our young people have grown up in the child welfare system, and choice was not something that they ever experienced. Information was not something that they were ever given. Lots of times decisions were made for them and they were informed afterwards. And so this is a really great opportunity to be able to inform them of choice and hear what they have to say. I really like to speak here in this area about, it's not making this section about self-determination. It's not so much about making things happen for the young people that we work with, but providing them opportunities. This means when we shift that way of thinking and when we shift that language, it's really not about us having control. And it's about walking again alongside them, holding their hand and putting opportunities in front of them to see what grabs their attention, to see what it might be that they are interested in. Our third one is positive youth development and wellness orientation. Again, jam-packed with lots of information. But what we know to be true is that young people are often more resilient and hopeful than adults, which is why we need to have two models, housing first and then housing first for youth. Lots of young people that we have had the opportunity to survey, that we have had the opportunity to hold focus groups with, just young people that we've been able to get to know that have been on our caseloads, sometimes don't even actually acknowledge that they're homeless. They think that they've hit like a bump in the road, and that homeless is about somebody who's like 60 or 70 years old, who is living on the streets and has been living on the streets for 15 years. So even if a young person can acknowledge that they've been kicked out of their biological home or their family home that they were growing up in, if they're not rough sleeping and they're just precariously housed, many young people won't acknowledge that as homeless. Lots of young people that we've had the opportunity to listen to also have a hard time believing that they're going to be homeless at 40. When these young people are 16 years of age, it's very difficult for them to see, 5 minutes in front of them, let alone 15 years. Again, they think this is just a bump in the road. It's just a period of time, and this too shall pass. And so that is really how we capture that resiliency and that hopefulness that young people have, where we're able to move them farther along on the trajectory in exiting homelessness and making sure that they don't have a touch point in the systems again. This part is also about managing expectations. It's about what growth looks like to that young person and developmentally where they are at. Again, talking about their ACEs, their adult childhood effects, where they're coming from, the environment that they lived in, all of those really robust pieces that we learn about them when we start to unpack and listen to what the young person's story is. We know nothing about the young person's lived experience or reality. So this is why we set expectations around something, or sorry. So if we don't know that they, where they're coming from, then how is it possible that we even set expectations around something that we know nothing about? Lots of times when this work gets hard, because it's all in the gray, It can feel frustrating. It can feel aggravating. You might leave shift trying to figure out what difference you're making. It's sometimes because the small successes can be overlooked. So a young person who typically doesn't respond to your text messages might all of a sudden start responding. That's positive youth development. There's a relationship that's building there. There's something that's happening there, and those small steps are really still steps forward. Remembering and going back to, again, post-secondary, where we learned about youth development, is that teens are supposed to be pushing boundaries. Teens are supposed to experiment through these developmental stages and this particular age range. They're supposed to be involved in risky behavior within reason. They're supposed to bring us attitude. They're supposed to wake up late. They're supposed to feel like they don't want to get a job and don't want to go to school. And so this isn't about young people experiencing homelessness. This is about young people showing us behaviors that are quite normal for all teenagers. Young people also need to hold their hand, and that's another reason why we've separated the Housing First and Housing First for Youth model in Canada, is because young people's brains are still developing. And so there are going to be many times that this is going to be a first for them. And so we do need to hold their hand, and we do need to take them along and not make assumptions that they've been shown this before or they know what this skill is like. I'm sure all of you can think about individuals, family members, natural supports that you had when you were growing up, and someone role modeled almost everything that we know, good or bad. It was role modeled to us, and that's why we know what we know today. Down to grocery shopping, how to clean a toilet, how to use a key in the door, any of them. The list can go on and on. And so young people are going to need somebody to role model all of these pieces as well. And that takes a lot of time. Our fourth core principle or guiding principle is individual client-driven supports with no time limits. This is kind of one of our like black and white rules in Housing First for Youth, if you will, is that our program does not have time limits. Again, we cannot put time limits on a young person's growth and development, and therefore that's going to look different for all young people. We are in the process of strengthening our data with opportunities that we have, with relationships that we have with certain Housing First for Youth sites up here in Canada. But what we do know to be true right now is that the average length of stay in a Housing First for Youth program is approximately 2.5 years for, again, an average young person. We've seen some young people need to stay up till 4 years. And that, again, is dependent on the age that they came in and where their developmental abilities were at that time. Young people, again, I've already shared this, but they're so unique, and so are their needs. They're going to evolve over time. They're going to have setbacks. They're going to make great accomplishments and great strides. So the nature of the range and supports and services that we offer them must also be adaptable. Not what is going to work for one young youth is going to work for another. And that was a very hard lesson that I learned, because I continue to think that once I had figured it out, I had figured it out for all young people. And that was, in fact, not true. And so, yeah, so I think that's kind of it there. Yeah. And then our last one, because we have 5, the big difference again between Housing First and Housing First for Youth is that in Housing First, there's very little time given to this principle, which is social inclusion and community integration. That is, for one of those reasons, is that in Housing First, when you're working with adults, the caseloads tend to be higher. I'm not suggesting that that is always, but the Housing First programs that we know of in Canada are upwards of 20 to 30 individuals, where in Housing First for Youth, best practice is 7 to 10, and absolutely not going beyond 10 per caseload. And that obviously is contributed to the amount of hand holding that young people are going to need, the amount of one-to-one support. Can you imagine taking 20 people grocery shopping in a day, plus getting your case notes done, plus answering all of your emails and phone calls and showing up to all of the meetings would make it very difficult. So that's why, for some of the reasons why we have the smaller caseloads. And another example that comes to mind for a young person that we were working with closely in another housing program just recently, that made me think about myself growing up, is when I was growing up, and I remember being at swimming lessons for the first time and being nervous to go over to the group that I needed to be with. I remember my mom kind of giving me a little bit of a push at the pool and told me to just go over and say hi. And she also reminded me to smile. And so if we think about how like those gifts, right, from a parent were given to me, that's kind of the intensity sometimes of the work that we have to do with young people within a Housing First for Youth model. This is probably some of the beginning stages of how I learned how to make friends. This is probably where I started to learn the importance of relationships and how they were going to impact my life. And I think one of the big pieces that we are constantly reminding ourselves in staff meeting within the Housing First for Youth models is that sometimes we might be the first adult or the first person to give them that nudge and to be able to introduce them to an activity, and take them places where they can meet people. I know last year was like a crazy bonkers year and maybe we couldn't have done that, but lots of our programs still got really creative. And our young people still didn't experience social isolation, which really speaks to the commitment to the model and the commitment to these young kids. And again, this takes time. Social inclusion and community integration cannot happen overnight. So just another reason why we do not have timelines in our programs. I think, Amanda, we're going to switch gears here, and we're going to talk about just like a few of the highlights of some of the things that we learned. So just on the next slide, like key, like 3 takeaways, because that's all really I wanted to like take up your time to provide. But thinking partners. Back in 2009, when we started off in Housing First for Youth, because it was such a different way to interact with young people, we were no longer coming what I would have defined as the group home mentality, because the agency that I was working for at that time, that's where many of us were coming from, was understandings and learnings from congregate care situations. Is that we constantly were coming up against situations where we were scared about making the wrong decision, or we also found ourselves trying to consequence young people for things that didn't make sense anymore. So instead, what we decided to do is we made a commitment to ourselves and the team with our leadership, that realizing that no one person can actually solely be responsible or own the responsibility of each of all of the pieces of the work. And so we started making collective decision makings and accountability as it was needed, and really using each other as a sounding board to say, does this sound right? This is the message that I'm going to send to this young person. What are you thinking of it? Is this, conveying the right messages of the 5 core principles, so on and so forth. It's really difficult to stop and to make those changes, but we did. And here we are 10 plus years later, not needing to do that, but still using each other as thinking partners all the time. I think the last piece, one of the other pieces is good supervision. Leadership and immediate access to supervisors who really have a good hold or understanding on what Housing First for Youth is and what it looks like when it hits the ground, is really quite important. Again, you don't need to be an expert, but reach out to those people and ask for supports, because that's what we did. And I think that it really helped us to understand the new way of working with young people that, I don't think is going away anytime soon, because more and more people are really understanding that housing first for youth is the way to approach young people with this type of intervention. And then my last piece that I would offer you as a parting gift is time and the space to fail. Uh, we had one golden rule in our Housing First for Youth programs, and that was to keep kids safe. So we always made sure that young people were safe. We knew that we were going to make mistakes. And lots of the times we told kids that we didn't always know which the right way to do things was, but we apologized to them. We sat on their couches. We said we were sorry. We role modeled what it was like to say sorry and take responsibility for our actions. But we never ever made sure, or sorry, we always made sure that young people were kept safe. Sorry, I lied to you, and that wasn't very nice of me. I also have one more. So this is like for sure my parting gift to you. Transparency and trust. If you are truly going to operate a Housing First for Youth program, so not like Housing First-ish, but true Housing First for Youth program, be kind to yourself. Know that there's going to be bruises, but the bruises do heal. Know that we always didn't get it right. So please know that I've just, find myself very privileged and honored to be able to speak to you and share with you some of our lessons, but know that I missed the mark a lot, and that I did a lot of apologizing and I did a lot of backtracking. Sometimes my ego got in the way because I didn't want to be wrong, and I had to acknowledge that. Sometimes I was tired of learning a new way of doing things, and I just knew it was easier to regress and try to do it the other way. But that wasn't good enough for kids. That wasn't good enough from the outcomes, and young people at this point were starting to share with us that what we were doing was right. And even if we did make a mistake, it was better than what it used to look like. So just be kind to yourself. And have transparency within your team to know that this might be hard, but it's the right way. Thank you, Amanda.
Thanks, Heidi. Okay, so I think, Andrew, you've been able to connect with us, which is great. If we can turn it over to you, if there's any comments or connections you want to make to some of the US context around early intervention and housing stabilization that's happening in the United States, and then we can turn it over to questions after.
Yes, can you hear me?
Yes.
Okay, sorry. I've had major connectivity issues, and rural Pennsylvania has not been kind to my internet connectivity. So I'm actually on my phone, like 100 yards in the backyard because I get no signal at the house. So just bear with me. And if I do drop out, continue onward without me. I have been coming in and out, but I think for a lot of the examples in the US, right? Like as we're doing our local cross systems collaborative work, we're seeing a lot of these discussions that are happening in a lot of our communities, right? Like these discussions about family support, the discussions about housing first for youth, and how that is going to be. How is that going to look like, right? So in our experience, a lot of our communities are starting to have those conversations and starting to develop innovative programmings that are going to meet the needs of young people. And it's one of the reasons why we brought our colleagues from Canada, is like so we can learn from these experiences, right? And hopefully learn some of the things that are going on with our northern neighbors, and being able to implement some of these practices into our day to day. So, and just some examples that we're seeing, right? Like I know, like in Western PA, their COC has really been working with young people. They have a strong youth action board, and really trying to engage with them and being able to uplift their voices and being able to have them involved in programming, and also just challenging how our rapid rehousing programs are operating, how our coordinated entry systems are happening. So there's a lot of promising practices that are emerging throughout the country that at least for us here in the US, we're really hopeful, and then also hope that we'll learn a lot from our colleagues in Canada. So I'll leave it at that and turn it back to you all.
Thanks, Andrew. Okay, so now that concludes the real bulk of the presentation portion. Instead of going to the Jamboard, I'll just ask that if there's anything that we spoke to today that surprised you or resonated with you or inspired you from what we shared, to just throw it in the chat. We're always curious to see what is the thing that really grabs you out of these kinds of presentations. And also share any questions that you have. And we have some time to be able to explore some questions together. I think we've got about 20 minutes, and we'll also give you a teaser for what to expect at the summit. So I'll give you a second to throw anything in the chat that you want that we can respond to. And we also don't need to go straight until 4 o'clock if if we don't have many questions or you want to take some time to digest. You're also welcome to email us with any of the questions, or if you're interested in learning more. I see that Mary Jane and Orpah have shared a bunch of resources in the chat as well that hopefully you'll be able to explore and see what things might inspire you in your community context. So I'll give you a second to just share whatever comes to mind. And maybe while you're typing, I can actually, no questions. All the information is amazing. Oh, thank you, Myra. It's been great having your participation. I'll share a little bit if there's any thoughts as people are kind of ruminating, that at the summit next week, we are having a workshop. It's at the end of the day on Thursday, just before the closing session. So what we're going to be doing is trying to keep it a little bit interactive. I know that there's going to be a lot of information flying at you over those 2 days. So what we're hoping to do is to have a discussion about systems prevention in particular. So looking at the role of public systems, and there's a lot of work that's been happening here in Canada around looking at how public systems either contribute to youth homelessness or ways that they could actually be stepping up to play a better role of making sure that young people don't exit from, for example, child protection, the justice system, health and mental health facilities, to make sure that there are plans in place and practices that ensure that young people don't hit the homeless serving system. So we're going to talk a bit about what we mean by systems prevention. We're going to also bring in a bit of human-centered design and get folks to do an activity together, to get to speak to one another, do a bit of a breakout, and then also want to get your interest to see, like, would you like us to expand on some of the systems prevention examples that are coming out of Canada and even in the US in a future webinar? Because it is just an hour, it'll be a whirlwind event. But we want to get as much out of that as we can, and then also know that it's not the end of the conversation. We're happy to continue to have these discussions and share what we're learning here in Canada with you at different opportunities. So I don't see any questions. I don't know, anybody have any other thoughts or comments before we close out for today?
I do have one question. It's Andrew. I think I think one of the challenges that I listen to a lot when I go out into the communities regarding housing first for youth is the time limit. So I'm curious to see or the question is as changing that mindset, it's really like the time is going to be up to that young person. The average is 2.5 years. It could be up to 4, right? Like some young people will stay there to 4. So did you find any pushback as you were shifting that? Because here, like a lot of our programs have a time limit of 2 years, right? And I know you've mentioned that, Heidi mentioned that like the average length of stay is 2.5 years, right? For what you're observing in Canada. So I'm curious to see if you can talk about that that shift in people's perception.
Yeah, I was just thinking as you were talking. So I think that from a funding perspective, we started having conversations with our funders to say, if young, and again, I apologize, I did actually look to see if I could find statistics that fit in the States, but didn't find as many that I was looking for. But what I can share with you is in Canada, the average length, that's not how we talk about that. The average young person that's leaving home from their biological homes is 28 years of age in Canada. So we started to have the conversation around, if my son is able to stay at home until 28, why are we expecting young people who have had extensive exposure possibly to trauma, who have high adverse childhood experiences, who maybe have suffered from neglect, who maybe have experienced homelessness or access to any of those services, or have had touch points in the child welfare system. Why are we expecting those young people to grow up faster and to see them, like for us to expect them to be more self-sufficient and contribute to adulthood and graduate and hold down a job and all of those kinds of things. And so I think, Andrew, I don't know if that actually answers your question, but I think that once we started to realize that we had higher expectations for our young people who maybe didn't have sometimes necessarily the best starts, that was really unfair. And I know that that sounds like very grade 2 for me to say unfair, but it truly was. It was unfair for us to think that these young people, and so literally from funders, from government, and this took years. Please know that this wasn't like a week worth of conversations. Leaders in our agencies started to realize that was all true. I think also too, we started to look at how young people were leaving the children's services system. Right?
Yeah.
Oh, yeah. So how they were leaving the children's services system, and it wasn't on positive terms. And so what did that have to do with anything? Big question mark. And what role did we play in that? Question mark. I have to tell you though, two of the positives about no time limits is that it alleviates all of the pressure from young people to think that they have to do something in a certain amount of time. And it also allows for that staff member to do some really incredible intentional work because the clock is not necessarily ticking. One of the things that people always ask me is, but like, how do you get young people to fly the coop, so to speak? Like, are they just going to stay here for forever? And honestly, I never saw a young person stay forever. Young people, the ones, over the 150 that I saw go through Housing First for Youth programs, not one of them wanted to stay connected to a caseworker. Not one of them wanted to live in a program for forever. Not one of them wanted to keep having, to share their pay stub information to determine how much rent that they were going to pay that month. They don't want that. They want to be able to fly on their own. So we didn't really ever face this like huge cohort of young people saying, I'm not leaving. Like, it just didn't happen. So yeah.
No, thank you. That actually makes a lot of sense. And it's also like it's almost like the experience, centering the experiences of young people in your decision. Like, it's almost like that's what you all did, right? Like, this is what we're seeing on the ground level, and then this is how then the system can be made in order to meet their needs, right? Like, and I think that's and that entire process, and thank you for sharing that process took time, right? Like, and I think that's where we're in the midst of, or at least that's what I'm seeing in a lot of our communities, really is we're having those conversations. So it's going to take time until we develop those interventions that are going to work, and making sure that we're putting the experiences of young people, like what are they really experiencing, and then designing those programs that meet their needs, or like in our field, meet them where they're at, right? Like, so I think that really makes a lot of sense, and a lot more advocacy work on our end. So thank you.
And that it speaks to that we've talked about assumptions today. And I think some of the things around like time limits, we had to actually challenge our assumptions of assuming that young people would stay forever, or what is the actual evidence to show that a 2-year time limit creates the best outcomes? And if the outcomes aren't there, then why are we doing this? And that's, I think, a lot of where the learnings come from, is in like really taking a look at what are our policies and what are the practices that we implement, and is the evidence actually supporting this, or where is it just done because of an assumption that was made somewhere down along the line? And it's really incredible what we learned through that. Okay, I don't see any more questions unless anybody else wants to jump in here and ask something last minute, but I think that that's all that we have for you today. So please feel free to reach out or tweet at us or email us, and we'll have a recording of this webinar as well for you to share. But thank you so much for joining us today, and have a great rest of your week, and hopefully we'll see you at the summit next week as well.
Take care, everyone.
Thanks, everyone.
Bye, everyone.